everyone, I am Dr. Shruti Wagmare and I am doing Masters in Musculoskeletal Physiotherapy from Sancheti Institute for Orthopaedics and Rehabilitation College of Physiotherapy. Today, I will be having a small discussion on basics of knee osteoarthritis. I'll be sharing the screen. Yes. So at the end of this talk, one will be able to understand about the introduction, that is what exactly is osteoarthritis, the pathophysiology behind it, types of osteoarthritis, any risk factors associated with it, grades of osteoarthritis, signs and symptoms related to it, and any special tests which are specific for osteoarthritis, and we will conclude the session. So, osteoarthritis is a common degenerative joint disease that results in wear and tear and progressive loss of articular cartilage, subchondral bone changes, and synovial inflammation, particularly seen in older adults. So, the most common joint which is affected by OA is knee, which is why because it is a weight bearing joint which frequently bears the stress of daily activities, which with resultant microtrauma to the articular cartilage. The prevalence of osteoarthritis globally is around 16 to 22.9%, whereas in India it is around 32 to 64%. Pathophysiology for osteoarthritis. So before going on to the pathophysiology, we must know the what is exactly the composition of a normal articular cartilage. So articular cartilage is composed of type 2 collagen plus proteoglycans plus chondrocytes plus some amount of water. So in a healthy state, there is equal balance between the synthesis and degradation. Therefore, the cartilage is maintained. But what happens in osteoarthritis is there is overexpression of MMPs, that is matrix metalloprotease, which is a degradative enzyme which leads to disrupted equilibrium, and therefore further there is loss of collagen and proteoglycans. Now, as an early response, the chondrocytes still try to maintain the balance by increasing the TIMPs, which inhibits the degradative enzymes, and that leads to increased proteoglycan synthesis. But as age advances, the repair becomes insufficient, therefore leading to further consequences like decreased proteoglycans, increased water content, collagen is disorganized, leading to decreased elasticity of cartilage. And further, there are macroscopic changes which can be seen, that is cracking and fissuring of cartilage, erosion of articular surface. Types of OA. So osteoarthritis is classified on two bases. That is, first is based on cause and second is based on location. So based on cause, it is further subdivided into primary OA and secondary OA, whereas based on location, it can be at patellofemoral or tibiofemoral. So let's learn each one of them. Primary OA mainly occurs in old age. It is idiopathic. It is more commonly seen than secondary OA, whereas secondary OA is associated with any underlying primary disease of the joint, leading to degeneration, which can be seen many years later. It can occur at any age after adolescence and is more commonly seen in the hip. The possible causes for secondary knee OA is post-traumatic, post-surgical, congenital or malformation of the limb, any malposition like varus or valgus, and scoliosis, as it affects the whole kinetic chain, leading to secondary knee OA. Coming to patellofemoral and tibiofemoral OA. So in patellofemoral OA, there is crepitus present on the patella and pain on compression, whereas in tibiofemoral OA, there is joint line tenderness and effusion. The pain, which is an important factor to differentiate between patellofemoral and tibiofemoral OA, is the pain is located in the anterior knee behind the patella in patellofemoral OA, and the pain is at the medial or lateral joint line in the tibiofemoral OA. The aggravating activities is climbing the stairs, squatting, and sitting long in patellofemoral, whereas tibiofemoral OA has difficulty in walking and weight bearing. The deformity seen in the patellofemoral OA is valgus, patella tracking issues, whereas in tibiofemoral OA, there is severe, we can see the varus or valgus deformity or any instability. We can see the patellofemoral OA in radiology